In this video, we are going to talk about very short topic, that is Bacillus cereus. So the Bacillus cereus is the gram-positive rods, and one of the main cause of the food poisoning uh, related to reheating the rice is known by the Bacillus cereus. So as I have already told, the main cause of food poisoning, the reheated rice syndrome, we also called it as reheated rice syndrome, is caused by the Bacillus cereus. What happens is that you know that the spores are the very resistant factor for the any bacteria. So the spores of the Bacillus cereus survives the cooking rice, and whenever we keep the rice warm, and it results in the germination of the spores, and there is the formation of the enterotoxin. So if we ingest those spores, in the large amount, and due to this enterotoxin, the ingested spores cause various signs and symptoms. We'll talk about that sign and symptom in detail. So again, I am going to tell you the reheated rice syndrome is caused by the Bacillus cereus. The spores of the Bacillus cereus survives the cooking rice, and when we keep the rice warm, there occurs the germination of the spores, and when we ingest those spores, we encounter various signs and symptoms. The main clinical features of the reheated rice syndrome are nausea and vomiting that occurs within 1 to 5 hours of ingestion of the spores. And there's occurred diarrhea also. The diarrhea is watery and it is non-bloody diarrhea. The GI pain occurs within 8 to 18 hours. So these are the various signs and symptoms of Bacillus cereus reheated rice syndrome. So initially there occurs nausea and vomiting, and later diarrhea occurs, and the diarrhea is watery non-bloody type of diarrhea, and after that there is the GI pain, gastrointestinal pain. The management of this reheated rice syndrome is supportive care. We ask the patient to take plenty of ORS, and if it is not uncontrollable, that means the vomiting and the diarrhea is not controllable, then we give antidiarrheal or antiemetics. We give antidiarrheal, the loperamide can be given, and the antiemetic drugs like ondansetron or domperidone can be given. So this is the short explanation of Bacillus cereus. Thank you.